Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we are honored to have a very special guest, Jen, who is our previous patient and still current patient, I guess. And so we did surgery on Jen almost 2 years ago. Um, uh, Besides that, she's one of just the most amazing, affable humans that I've ever met. I'm not just saying that. So it's been an absolute honor getting to know her, even beyond what we've done surgically. So thanks for being here.
Thanks for having me. And I'm excited. I get to ask Dr. Ladner some questions instead of the other way around.
That's right. I'm a little bit scared.
You should be.
No, especially coming from you.
All right.
So let's do it.
Question one.
Okay.
Ready?
Yep.
What were you thinking when I first walked into my consultation?
The honest truth on that one is that I have patients where it's I don't want to sound crass, but it's kind of obvious why they're there. There are obvious signs, signs of aging or otherwise, for why they made the appointment. And I would say that Jen is she's beautiful, she's naturally beautiful. And so I would say, it's probably said to myself, why are you even here? I don't think you need a whole lot of surgery. So, yeah,
That's really
that's
sweet.
the truthful answer. Yeah.
That's really sweet. Okay. Now I got to talk after that. All right. Next question.
Yeah. Next question, number 2.
Do you ever get nervous before surgery?
No, I don't. Surgery energizes me. Obviously, it's what I do, all day, every day. Like any job, the nerves and anxiousness and so forth, you lose that pretty quickly, to be quite honest, like in your training. There are certainly some cases, obviously less so now, being 15 years into my practice, but some cases going into it that, we're going to be a little bit more challenging because they just are. Sometimes those are revision cases. Sometimes they're just interesting cases, unique situations. But I would say that actually probably excites me more than it makes me nervous.
I could see that.
Because it allows me to do the mental preparation going into the surgery. I think that's kind of invigorating, especially at this stage of my career, where, oftentimes it can become routine doing the same surgeries time and time again. And so when we have those unique situations, I think it's kind of fun. Yeah.
Love that. Okay. This one's a good one. Ready?
I don't know if I'm ready.
What's the weirdest thing a patient has ever asked you to do?
Okay, so with fat grafting, a patient specifically asked me if I could put in enough fat to make them look like a monkey.
Oh.
My
I would
answer,
love
my,
to
my
have
answer
seen that
was my
answer.
answer was yes, but I'm not going to do it.
Wow. Okay.
That's got to be one of the weirdest ones I've heard.
That is interesting. Very interesting. All right. What do you like to do to unwind after a long surgery day?
Yeah. So pre-children, there's
Pre and post?
There's pre-child life and there's post-child life. Pre-child life, it was definitely getting outside. I'm a very active person. So whether it's going for a local hike or going for a run or surfing or doing something like that, working out. Post children, it's seeing my kids because they have so much energy, even at 6:30, 7 p.m. at night, that it actually kind of gives me a second wind, even after a long kind of mentally taxing day or whatever. The minute I get home and I play with my kids, it's just this burst of life, and so that's how I unwind now.
I love that.
Yeah.
I love that. All right. Ready for a couple more? Just
Couple more. Okay.
Be honest. Do you look at people's faces differently in regular life now? Like at a restaurant or if you're in line somewhere, are you scoping them out and be like, I could so fix that?
So honestly, I really don't do that, at least anymore. I think that during my training and then maybe early on in my practice in my career, I might have been doing a little bit of that. But now, I'm in my job 50, 60 hours a week, sometimes more. And so I try to, leave that work stuff at work, and focus on the other, parts of my life. And so, to be quite honest, I feel like if I'm, and I won't name names, but if I'm with other staff and we're having a staff event, I find that maybe they're checking out other people's faces more than I am, and I'm just sort of listening to what they're saying, and I'm kind of zoning out. So yeah,
Okay.
I truthfully don't.
Okay.
Yeah.
Okay. What's the most surprising result you've ever seen where the outcome was better than you ever could have expected?
Geez, that's the toughest. You say the toughest question for last. That is a really. I'm gonna answer that vaguely, because I don't think it's necessarily me looking at a before and after and saying, "Oh my gosh, yes, wow, that was the most amazing job I've ever done." I think it's and I don't have a specific person in mind, but I think it's the reaction of the patient that actually kind of brings more of that joy to me, or more of that feeling of satisfaction. And quite honestly, I think maybe just cultural generational changes, but this used to happen more often early in my career. But when the patients would come in and hug me and cry, and hopefully out of joy, but and just express their sincere gratitude for me and the staff. Those are for sure the cases that stand out to me more so than just the individual before and after metamorphosis. So
I love
yeah,
that.
I
love
skirted that question, but I think that's the honest answer.
That's awesome. Well, I appreciate being able to ask you questions for once.
Well, thank you. They weren't too tough. And if you guys liked what you heard today, please be sure to like the video and also subscribe to our channel.